Thank you very much for your interest in our study. The project is entitled Short and Long-Term Risk of Colorectal Adenoma Recurrence Among Whites and Blacks. Many studies have demonstrated that blacks in the United States have a higher mortality from colorectal cancer when compared to other race ethnicities. Factors underpinning this disparity are poorly understood. Some studies have shown that blacks tend to have poorer access to healthcare resources, and when they even have access, they are less likely to utilize these resources. However, some other studies have demonstrated that blacks tend to have more biological susceptibility to developing colorectal cancer. It is unclear what interventions will be effective in reducing or eliminating this colorectal cancer disparity. Recent studies have shown that care providers tend to conduct or perform more surveillance colonoscopies among blacks, even when blacks have no adenoma at baseline, and sometimes when they have adenoma at baseline, the more colonoscopies are performed in excess of the guidelines. Therefore, we sought to evaluate whether blacks who have had adenoma removed are actually at an increased risk of developing colorectal adenoma when compared to whites. We used data from the polyp prevention trial for this study. The polyp prevention trial itself was a 4-year multi-center randomized control trial that evaluated the effect of high fiber, high fruit and vegetable, and low fat diet on colorectal adenoma recurrence. In this trial, 1,900 patients completed this study, in which a group, the intervention arm, underwent this dietary change, and the control group ate their usual or their typical food during the course of the 4-year trial. At the end of the trial, the dietary intervention did not have any effect on colorectal adenoma recurrence. So the current study that I'm describing is a secondary analysis of the polyp prevention trial. We identified 1,668 non-Hispanic whites who completed the polyp prevention trial. We also identified 153 self-identified blacks. The race ethnicity in this study was by self-identification of the patients. And we identified 153 non-Hispanic blacks who also completed the trial. We then evaluated the occurrence of adenoma subsequent to the baseline in the study. At the end of the 4-year trial, 39% of blacks and 39% of whites actually developed adenoma recurrence. Now, after the polyp prevention trial ended, a subset of patients agreed to be followed for additional years, during which they were only under the care of their care providers. Of this, we identified 688 non-Hispanic whites and 55 non-Hispanic blacks who underwent additional colonoscopy, one additional colonoscopy after the polyp prevention trial ended. We then evaluated the totality, the cumulative recurrence of adenoma over a maximal follow-up period of 12 years in this cohort of patients. At the end, we documented that 67% of blacks and 67% of whites developed colorectal adenoma at some point in time during this 12-year maximum follow-up. The implication of this is that blacks were not more likely to develop adenoma when compared to whites. That is, blacks and whites, they were equally as likely to develop colorectal adenoma recurrence. after they have had adenoma removed at baseline. This suggests that it is not necessary to have blacks undergo more frequent surveillance colonoscopies after they have had adenoma removed in excess of the guidelines, as a way of thinking that we'll be able to reduce their risk of colorectal cancer. There may be other factors that we need to explore to find a way to reduce colorectal cancer disparity, but our studies suggest that frequent or more frequent colonoscopy in excess of the guidelines is probably not an effective way to reduce colorectal cancer disparity. Thank you very much for your interest in our study.